all you're doing is giving you a pill for a symptom. They're being told that they're normal.
That's what they always say. Like, your labs are normal, everything's fine. But you're like, I know something
Yeah.
is not right.
We tested turmeric from one of our suppliers, and all it was sprayed rice powder orange. These patients are driven from doctor to doctor, and they feel horrible, think that they're crazy, think that they're lazy. They're completely hopeless.
Yeah, and
And-
while your thyroid is slowly dying,
Yeah.
every single person has been waiting for this podcast. Everyone asks me about my story, about what I know, what you know, but 1-minute short videos just isn't enough.
We probably have the largest Hashimoto's clinic in the United States. We probably see anywhere from 200 to 300 patients a day, and about half of them have Hashimoto. The biggest goal for us is to identify the underlying mechanisms that are driving it, and how can we correct those and improve those.
What are like 3 supplements that every single Hashimoto's patient should be on?
Vitamin D K2, glutathione. You can check for a methylation problem by checking homocysteine. Almost 50% of all people in our country don't methylate properly. There's some patients that don't have the means or the ability to see us. And so for me, it was just about giving back and doing all that we could to share the information that we have and put it out into the public. How many good days do you think you have out of a month where you actually just feel really good all the time? And I remember you said a few good days a month. And now, how many good days do you have out of the month?
I honestly can't even remember a bad day.
You're not crazy. You're not lazy. It's just you're being mismanaged. And you have to get to the mechanism of why you feel bad versus just treating symptoms.
Welcome to the She's in Progress podcast. I'm Dr. Alexandra Lourdes, and this is episode 4. I can't believe it, honestly. This feels so cool to have 4 podcasts in. I read all of your comments on all the last podcasts. My brother and I, Chris, we like to go through them, and it's really fun to read everyone's comments. And overall, everyone is loving the podcast, which means so much to us. So thank you so much. And on that note, make sure you like, subscribe, and share this podcast with whoever you think may like it, because that helps us grow together. So today is going to be a really special podcast to me. It definitely was one of the most requested podcasts because besides my donut content, everybody asks about my anti-inflammatory journey, my Hashimoto's journey. So today we have a really special guest. So Dr. Josh Red is here. Woo woo.
Let's go.
He literally just flew in
Let's
from
do
Utah.
this.
Welcome. Isn't
Look
that
at this
exciting?
setup.
I know.
What the?
Isn't it amazing?
Amazing. Yeah, this
I
is
know.
awesome.
Chris found it.
Chris,
Chris is the reason we have this podcast.
like this matches you.
I
This-
know. It's such a vibe.
It is such a vibe.
Yeah.
I love this.
Welcome. I'm so happy
Thank
you're
you.
here.
Thank you for
I
having
feel like
me.
every single person has been waiting for this podcast because everyone asks me about my story, about everything about what I know, what you know, but 1-minute short videos just isn't enough time to
Yeah,
explain.
for sure.
So today I'm going to tell you guys a little bit about my story. So we'll start with, it was about 9 years ago, and I actually had a miscarriage with before Sophie. And then I was trying to figure out like why that happened. And then I also I had weight gain like crazy, and no matter what, I would work out every single day and I would eat so clean and what I thought was clean. And then I just couldn't lose weight. I just kept gaining weight. I was tired at like, I would wake up tired. Like I would be exhausted and I'm like, I had a full 8 hours of sleep and I was just tired. And so after the miscarriage, I went to a doctor and they found out that I had high TSH, which is like a thyroid issue. And so it's like what's it called?
Hypothyroid.
Hypothyroid, yeah.
Yep.
And so then they're like, you need to go see an endocrinologist. So I went to an endocrinologist and they tested me for antibodies, which is rare. I feel like a lot of people don't
Yeah,
test for that,
yeah.
right? So they tested me for the antibodies and then they're like, oh, you have Hashimoto's and hypothyroid. But it's okay, there's nothing you can do for Hashimoto's, which is a typical response from a doctor, an endocrinologist. And then I believed him, and he put me on thyroid medicine. And from then, my symptoms were a little better. My TSH went down, but my symptoms were still there. So I still had the fatigue. I still had the weight issue. I wasn't able to lose weight correctly. I actually wasn't able to gain muscle. It was weird. Like I would work out and I have a lot of,
Yeah.
like strength training, and I could never gain muscle. I don't really ever feel like I had brain fog, but maybe I did. I called it ADD because I'm just like all over the place all
Yeah.
the time. And then, so those were like my typical symptoms. They weren't like terrible, but it was just exhausting to feel that way and knowing I was like bloated all the time. And then I had a gallbladder issue and I had to have my gallbladder removed. And I'm like, something is wrong with me. Like there's something inside wrong with me. I know that it can't just be Hashimoto's. There has to be something you could do for Hashimoto's. So what happened was I went to another endocrinologist. I found another one because this endocrinologist, he just kept telling me to just keep going on my thyroid medicine. He's like, you're just going to keep increasing your thyroid medicine because over time your thyroid is going to slowly die because of the Hashimoto's. It's going to attack it. And it's okay. And I'm like, how is that okay?
Which is absolutely crazy, right? We have so many patients from all over the country and world that have so many different symptoms. They have miscarriages. They have all these things that are breaking down their body. They're being told that they're normal and that things are
Yeah,
just,
the labs are normal.
you know,
That's what they always say. Like, your labs are normal, everything's fine. But you're like, I know
yeah,
something is not right. Like,
yeah.
something is not right. So I went to another endocrinologist and he said the same thing. He was like, Hashimoto's is fine. Like, a lot of people have it. Isn't it like the number
It's the
one?
number one autoimmune condition in the country.
Yeah,
And almost 12% of our population has thyroid issues.
that's so
The bulk
crazy.
of them are derived by autoimmune responses, which is Hashimoto's. And here we are, these patients go from doctor to doctor to
Yeah,
doctor, thinking that they're crazy, wondering what in the heck's going on with my body. And they have no answers and they feel hopeless.
that's how I felt. So I was at that moment, and luckily I had an audience at that point. So this was like 2 years ago. Was it 2 or 3 years ago
Yeah, a
that
few
we
years
met?
ago. Yeah.
And so I had had an audience on Instagram. So I was like, let me just ask my audience because maybe they know something. Like, because that's what the internet's so great. Like, makes us all really small, which is amazing. So I posted on a story and I said, I'm so sick of doctors telling me there's nothing I can do for Hashimoto's. Is there anyone out there that knows anything that could help me with my Hashimoto's? And I put a question box, and immediately it was just like flooded with responses of not only people just saying like, I need help, I need this too, I need help too. And then the other responses were just full of recommendations. Two people came up. Red River was just like tons of responses, and then Dr. Josh Red. And Red River is his clinic. So it's literally just him and him.
Which I love. That brings me so much happiness
Isn't that
because we work
crazy?
so hard to make sure that we help patients and we really are the best in the country. And so to hear that all your followers suggested Red River and Dr. Josh Red as the top two,
Yeah.
that's
Isn't
fantastic.
that crazy? And it was like not just like five people. There were like hundreds of people. Just
That's
like
awesome.
Dr. Red, and Red River, Red River. So
We love the support.
yeah,
We
it was
love it.
amazing. So then I reached out to you on Instagram because you have a big following on Instagram too. And I was like, maybe he'll see my message. And then
Yeah.
he wrote back right away. He's like, my kids love watching your donut videos.
Yeah.
And I was like, yeah.
Yeah.
So it was like such a crazy small world. And he's like, come see me. And so then we did labs right away. And so should we go into that? Or do you want to talk about a little bit about kind of what you do at Red River? And like, because Dr. Red is the doctor to see if you have Hashimoto's.
Yeah, so we probably have the largest Hashimoto's clinic in the United States. We probably see anywhere from 200 to 300 patients, and about half of them have, I should say, 200 to 300 patients a day, and about half of them have Hashimoto's.
Men and women, right?
Yeah,
Yeah.
men and women. Um, so the biggest goal for us is instead of just treating symptoms, instead of just herding you around like sheep and giving you a thyroid hormone, which is important, we want to get to the mechanism of why this patient feels bad. So if somebody has Hashimoto's, they can have low thyroid, but then an autoimmune condition, which is actually destroying the thyroid at a rapid pace and causing low thyroid, is being totally neglected. And so the biggest goal for us is to identify the mechanism. If they have Hashimoto's, what are the imbalances that are driving the Hashimoto's and making it worse? And what can we do to get to the underlying mechanisms that are driving it? And how can we correct those and improve those? And then on top of that, as you know, there's a ton of lifestyle and environmental things that will trigger the autoimmune response too. So one of our biggest goals is to teach you and educate you and show you what to do and what not to do so that you can be the expert in your own health, right? And
Yeah.
so it's just a lot more comprehensive process versus, okay, here's your thyroid hormone. We'll see you every 6 months versus, okay, that's great. You need thyroid, hormone function. But even the bigger goal is what's the mechanism driving that and what are the imbalances driving that? And can we identify all those issues and then correct them? And then obviously your quality of life is going to be a lot better. Then here's the biggest thing is Hashimoto's is more of a systemic and inflammatory process. So it's not just your thyroid that's impacted. It's your brain, it's your liver, it's your intestinal tract, it's your whole body. You can be inflamed. So many different factors can contribute to this. It's so much more than just my thyroid is not functioning well.
Yeah.
But these patients are driven from doctor to doctor being told it's just their thyroid, and they feel horrible, and they think that they're crazy, think that they're lazy, think that they just, they're completely hopeless.
Yeah. And
And
while your thyroid is slowly dying.
yeah,
It's
yeah.
crazy.
And then not only that, if all you're doing is giving you a pill for a symptom, your autoimmune condition, which is Hashimoto's, can turn into other autoimmune conditions. So then in 10 years from now you have rheumatoid arthritis, or you have MS, or you have celiac disease, or whatever that may be. Like,
Yeah.
your body just breaks down. And then talk about just not being able to have kids, or having a miscarriage, or having 3 or 4. Like, these are patients' lives that we deal with, and it's heartbreaking. So, like, when I first sat down with one of my first patients, she was asked to draw or her son was asked to draw a picture of her at school, and he drew a picture of her in bed.
Aw.
And he brought that home, and she pulled it out of his backpack, and she's like, "What's this, honey?" And he's like, "That's you, Mom, because you're always in bed." And she was in the same position as you. Like, these stories are everyday stories that we hear. And so even for the listeners or people watching this, like, you're not crazy, you're not lazy.
Mhm.
It's just you're being mismanaged.
Yeah.
And you have to get to the mechanism of why you feel bad versus just treating symptoms, right?
Because for me, like for an example, like mine had nothing to do with my thyroid, actually. It was my sugar, my blood sugar.
Yeah.
My blood sugar was extremely low. I had hypoglycemia. So because I wasn't stabilizing my blood sugar, I was having an inflammatory response.
Totally.
Also, my gut issues, I had
Yeah.
whatever, I don't know what you know more than me that what I have, but basically he targets different things. So like I had to fix my gut with probiotics and a bunch of other supplements. I was really low in iron, so we had to supplement that. All these things together were causing my inflammatory response.
Yep.
And that was
Exactly
triggering
right.
Hashimoto's.
Yeah.
So since I've been working with him, it's not, I don't even think it's been a year, but my markers for a lot of people ask me about if all my labs have improved, and they've improved dramatically.
Significantly.
Yeah.
Yeah, from the first time to now, they keep getting better and better too,
Yeah,
which
it's
is great.
nuts. Like
Yeah.
my antibodies were in I think 500, 600s, and now they're about 80.
Yeah.
So we're on the way down, which is amazing, but it does take a lot of work. It's not just like you said, it's lifestyle changes, it's, diet changes, our anti-inflammatory diet. So, yeah,
Yeah.
let's see what else do we have on the list.
So sorry to interrupt, but let's talk about a little bit about your background if we can. So like what got you
Yeah.
into medicine? What got you into
Yeah.
the field?
Yeah.
If we could just to give
For sure.
the audience just a brief background on who you are.
Yeah. So the longest time, I've always knew, even in my teenage years, that I wanted to work in medicine. But I knew that from a medical standpoint, like traditional medicine, they, like, if you had diabetes, I remember I had a family member with diabetes, and they like didn't really address their diet. They just gave them medication for the diabetes. And I always thought that was weird, even as like a teenager, right? And so my goal was I want to go to medical school and help people. But then I realized they didn't teach nutrition in medical school. And so I was like, well, crap, I want to do this type of treatment, which is functional medicine, but they don't learn any of that stuff in medical school. So I ended up going to chiropractic school. And then I did that, and I didn't do any chiropractic. I opened up my first clinic and just did functional medicine from the very beginning.
Oh, wow.
Like, I don't adjust people or any of that stuff. And then I did a master's in human nutrition and functional medicine. And then after that, I did an immunology degree at Johns Hopkins with public health biology. And I
Just
focused
John
on
Hopkins. Just John.
but did a kind of had an emphasis on molecular biology and immunology. And then there we learned about stem cells and what we could do. One of my professor's labs, they could sever a mouse's spine and make it quadriplegic, and then inject stem cells, and they could fully walk again. So I remember at that point, I had already had like 5 to 6 functional medicine clinics that we dealt with autoimmune conditions. And I was in there learning, and I realized, holy cow, this is going to change all of healthcare.
Yeah.
I got to do it. And so from that point, I ended up going to a medical school in Chicago, and a naturopathic medical school in Chicago, and then just finished a residency for regenerative medicine and stem cell treatments. And here I am. And if I do any more schooling, my wife would for sure divorce me. She's in the background here, but no more
She
school.
works with you now.
Yeah, she kills it. Yeah,
Yeah.
she's a nurse, and she's my favorite confidant there. So,
When would you say you felt comfortable enough to open your own clinic and kind of do things on your own?
as soon as I graduated chiropractic school, I opened my first functional medicine clinic, and
Red River.
it was Red River.
Okay.
And we helped a TV anchor that was similar to you, had a lot of different symptoms and problems, and nobody could really find out what's going on. And within about 60 days, she felt better than she did in 15 years of going through the traditional medical treatment. And from that point on, I'm like, holy cow, we're onto something. And back then, lots of people know what functional medicine is now. Back then, I was like on an island all by myself doing functional medicine, right? Lots of people were wondering, what the heck is this guy? This guy can't treat these conditions or help these people. And about 50% of the population at the time hated me.
Oh my gosh.
It was,
Yeah, that was crazy. That remember
um,
that story about so I have thyroid nodules, like so a lot of women do, right? I mean, I think everyone does at some point in their
yeah,
life, right? They
yeah.
like develop and go away. But I wanted to go get a second opinion, and he's like, come to my favorite
My favorite
endocrinologist,
endocrinologist. Yeah.
and he's in Utah. So I was like, okay. So I flew up there, and he told me this story about at this time. You want to tell the
Yeah,
story?
yeah.
Yeah, because it's more
So
fun.
I didn't really even have to shave at the time. I was just, it looked like I was still 12 years old, seeing all these people from all over the country that were coming in to see me for their autoimmune condition. And I think a lot of people at that time just didn't understand what I did, and they were thinking, what is this guy going to adjust their spine and cure them? And that obviously wasn't the case. I was just doing functional medicine where we were doing intense blood chemistry, looking at their panels, trying to change their diet, nutrition, and lifestyle to optimize their overall health. And I would have these patients that would come to me over and over and over again, and they kept saying, like, one day I had a patient, like, I think 5 patients where they said, "Hey, this doctor keeps saying this about you and this about you and this about you," just horrible things. And I was like, "Ah, screw that." So I finally just got sick and tired of it. During my lunch break, I drove to his office and was like, "I'm talking to this doctor right now." And they're like, "No, no, he can't talk to you." I was like, "No, go get him right now. Interrupt the patient. I'm talking to him right now. This is bull crap." And like I was ready to fight him. And the doctor comes out, and I'm like, "Hey, I need to talk to you right now." We sit down. I say, "Hey, this is like the 6th patient today that I've had just say awful things about me. We need to sit down and have this conversation."
Because
And
they thought that doctor thought what you were doing wasn't working,
yeah,
right?
yeah,
Yeah.
I don't know what was happening, but anyways, so we sit down, and he starts asking me questions, and he starts to realize that I understand the body really well. I understand physiology really well, and at the same time, I can prescribe now, but I couldn't back then. So we would refer tons of patients to him, like we were on his team, you know.
Yeah.
Um, and I think he realized then, like, oh yeah, we are on the same team, and I do know what I'm talking about. And then from that point on, we ended up referring a ton of patients back and forth, and we became best friends. And now I mean, he kills it as an endocrinologist. He is so good, and yeah,
Yeah, he
he's helped
helped
lots of
me.
people. Yeah, he's helped you with the
Yeah.
nodules, and um,
What he can do, I mean, now I feel like now he's even looking I mean, he's like one of the top only 3 that has that machine that could do what is that machine
yeah,
that
so there's a machine where lots of people that have massive nodules or even cancer or all sorts of problems with their thyroid, they'll actually have to remove your thyroid, and then you lose thyroid function for the rest of your life.
Yeah.
Whereas he's one of only a few people
I
in
think
the
he said
country,
3.
yeah,
Yeah.
that can actually do a procedure where they basically hold this machine up, and is it like
I
almost
think
like microwave
it's
technology
like a
where they
laser, right?
yeah
Yeah.
where they remove the nodule non-invasively,
Yeah.
right?
Yeah.
Which is
And he
pretty
said you get to
cool.
keep your thyroid, which is unheard of.
Yeah. So
So,
we'll
that's
have
really
Graves'
cool.
patients. Graves' disease is an autoimmune condition of the thyroid as well, but it's where you're hyperactive, and it can actually be deadly. And he's helping some of our Graves' patients where he's using this machine, this laser, to where they like minimize the overactivity of it, and now their thyroid goes back to normal too, just with that. So it's
That's so
pretty
crazy.
awesome. Yeah.
One of my really good friends has Graves. A lot of people I know has some sort of autoimmune disease.
Yeah.
And
And here's the cool thing with when it comes to autoimmune conditions, the mechanism is your immune system. What it is attacking is different, right? So the way that we treat an autoimmune disease in general, whether they have one autoimmune condition or 5 autoimmune conditions, is essentially the same. Where it's like, let's go in and do all the testing. Let's identify the imbalances that are driving the autoimmune response, which are different from one patient to another. Let's look at the dietary and lifestyle triggers, which are different from one patient to another. But if
Mhm.
you can really target what those are for that specific patient, whether they have MS, rheumatoid arthritis, Hashimoto's, celiac disease, you name it, it's essentially getting to the mechanism, which is the immune system, and the way that we address that is pretty similar. So,
Yeah.
yeah.
So if I can ask, so you talk about your Hashimoto's to your audience. You just said one of your friends has Graves. I have Tourette syndrome. And so like it just speaking about the medical. Before it was nobody shared their medical journey, and now like so what I would say what influenced you to talk about it on social? Kind of what got you into social and bringing your audience into social and allowing people to kind of talk medical publicly.
Yeah, for me, we have one of the most successful clinics in the United States, and so for me, it was more about just giving back to the community. Whereas If they come and see us, they might see one of our doctors 30 times over the course of the next 6 to 9 months, right? And there's some patients that for some reason or another just don't have the means or the ability to see us. And so for me, it was just about giving back and doing all that we could to share the information that we have and put it out into the public. The cool thing about us is because we see 200 to 300 patients a day, I pretty much have my own like research lab within our clinic.
Yeah.
I can look at the research and then I can shoot a text out to our doctors to say, hey, let's make this one change and see if this is more effective for patients. They'll implement that strategy and we can see if it works or doesn't.
That's so cool.
Sometimes research that says it's incredible, when we apply it into the clinical model, it doesn't work at all. It's actually terrible. But then the times where we do all the research, apply it, and then all of a sudden it makes a profound impact for those patients' lives, then that's when we really dominate. And I want to share that information to the public so that everyone has access to that information too, right?
Yeah.
Since you're
Similarly, I mean, yeah, because when I learn, I feel the same, like I feel like I am fortunate to have access to you,
Yeah.
or maybe that, like you said, they don't have the means or, they just can't travel, or sometimes they don't even know who to reach out to. Like I was,
Yeah.
I felt like that. So now that I know and I have this knowledge, I feel like it's almost like my responsibility to share it
Totally.
with people so that way they know what's the next step for you. Like you don't have to be stuck. You don't have to feel horrible for the rest of your life. Like there is a
Yeah.
way to make yourself feel better, and it's not, you don't have to be stuck on medication your whole life.
Totally.
So that's how I feel. Like after I learn something, I have to share it with my audience because I feel like it's my responsibility to, because once I know something that works, like that's, it's so nice to give it to other people.
Totally. And there's some patients that will have to see Red River because their condition is a lot more complex. And we see patients from every country in the state or every state in the country, and then 30 different countries throughout the world as well. So we see lots of people just through telehealth, and that's great. But at the same time, if we can provide this information, there's a lot of patients that can just provide the simple strategies that we give them, and it makes a world of a difference as well.
Should we talk about that a little, maybe? Like, should we talk about like the top 5
Yeah.
things? Like,
Yeah.
what are some pieces of advice that you can give to somebody if they're suffering with an autoimmune disease? Like, what are the
So,
things they should do?
so this is very generalized. So I'll emphasize that first. The biggest thing for Red River is we want to get to the specific issues for that specific patient. It's very individualized, right? But there are some generalized things that are really common that we see with our patient population. So from a dietary standpoint, if you have an autoimmune condition, um, gluten and dairy are the 2 biggest food triggers that we see flare up our autoimmune patients, unfortunately. It's not even science. I mean, it is science. We see tons of research and literature, but this is what we see on a consistent basis. It's just how it is. Other patients could react to like eggs or corn or rice or
Soy.
other stuff.
Mhm.
Soy in America is absolutely garbage. So we really don't like our patients
Yeah, cut
regardless
it out
doing
completely.
soy. But dairy and gluten are probably the biggest food triggers. The other really common one is just sugars.
Yeah.
So sugars dropping or sugar spiking, the insulin surge will produce enough inflammatory responses that will really flare up an autoimmune condition. So if somebody comes to us and they have really unstable blood sugar levels, one of our first things that we'll do is to try to stabilize their glucose. So gluten, dairy, stabilizing glucose. We'll have our patients wear a continuous glucose monitor. And the biggest goal for us is to get their glucose from 80 to 130, regardless of what they eat or don't eat. If we can stabilize that from 80 to 130, their immune response is going to function way better than if their blood sugar levels are just all over the place.
Yeah.
Other common triggers, there's a lot of different environmental triggers that people will have. Obviously, mold, certain types of heavy metals, things like that we'll need to look for and screen out. Those are big ones. There's other environmental things as far as just makeup that you put on,
Hmm.
things that you wear,
Like perfume.
laundry detergent,
Yeah.
things you wash your hands with. That could flare it up, but it's different for each patient. And then from a physiological standpoint, we talked about blood sugar imbalances, which are really common physiological triggers. Cortisol defects, which is a stress hormone, which is probably one of the bigger ones for you.
Mhm.
Um, Anytime somebody has cortisol rhythmatic issues, that's a big trigger. There's a lot of people that will see, like, you'll hear that you have adrenal fatigue. Do you hear that like often? Where like I have adrenal
I've heard that
fatigue
a
or
lot.
whatever that may be.
Yeah.
Um, That's a common trigger, but it's not really adrenal fatigue. What they're really meaning is that they have adrenal circadian rhythm issues. So in the morning, our adrenal glands should be our cortisol levels should be really high, and then they fall throughout the day. There's lots of patients that will have really low cortisol in the morning, and then they actually rise at night, or they're just not how they should be. And that flares up the autoimmune response quite a bit too.
That's interesting.
So then they have insomnia, sleep issues. They're tired throughout the day, and that's just driven by cortisol. But cortisol is a huge trigger to flare up the autoimmune response too. The intestinal tract is obviously a really big one.
Yeah.
How they digest food, how they absorb food, how they absorb nutrients, how their immune system reacts to the food in their intestinal tract can be a big trigger.
That was a big one for me, I think.
Yeah,
Because I wasn't absorbing iron, I wasn't absorbing anything because my
totally.
intestinal tract was all messed up. So I think
Yeah,
once we fix that with the treatment, I think because remember my iron
yeah,
increased.
yeah,
Yeah,
Yours was
yeah.
specifically Hashimoto's,
yeah, mine was specifically
and you're kind of
Hashimoto's.
going on to multiple
Well,
thyroid conditions.
what I'm saying is these imbalances that I'm discussing are common triggers for Hashimoto's
Things to
and
look out
for
for.
autoimmune conditions. What I'm talking about is the mechanisms that drive these autoimmune conditions and make them worse. So, like in Alex's case, she had intestinal permeability where her intestinal lining was so thin, she wasn't absorbing nutrients like that she should. She wasn't absorbing iron,
Yeah,
and just that one mechanism causes issues with Hashimoto's. But it also causes fatigue because her body can't distribute iron throughout the body, right?
yeah.
And then on top of that,
I'm sorry to interrupt, but would you mind like explaining, I guess, Hashimoto's in like to the audience, like
Like
in a
what is
summary, like kind of
Hashimoto's?
just like in a quick
yeah,
something that
yeah.
somebody
So when somebody has a thyroid condition, about 90% of those individuals will actually suffer from a bigger, more complicated autoimmune condition called Hashimoto's. And this is where your immune system destroys the thyroid at a rapid pace and eventually causes a permanent low thyroid. This is where we fail, though. The medical model will look at this and see that they have a low thyroid, and they'll just prescribe you with a thyroid hormone. They do nothing to the bigger, more complicated condition, which is the autoimmune condition. And then not only that, but the Hashimoto's will in turn cause so much inflammation in the body that it causes brain inflammation. So then they have brain fog, decreased clarity, they have neurobehavioral type issues, and then it causes intestinal issues. And then they have poor absorption, poor digestion. They start to absorb certain proteins in the bloodstream that they shouldn't. And then that flares up the Hashimoto's even more.
That's what happened to me.
Yep.
All of that.
Then they have
'cause,
blood.
the word, I mean, the thyroid that you're referring to, I think a lot of I've just heard it in my life that a lot of women refer to their thyroid when they're referring to weight, like trouble losing weight,
Yep.
right?
Yep.
So and then it's usually really linked.
Totally. They'll gain weight. They'll have all sorts of weight issues. But on top of that, they're saying their thyroid. If you had a doctor really look at that, though, the culprit is not even the thyroid. It's just the symptom of a much bigger problem. The culprit is actually an autoimmune response. So it's the immune system. So what they should be saying is, my immune system isn't functioning, but they haven't gone to the right doctor to figure out and tell them that, hey, your thyroid is just a symptom of a much bigger problem. But they blame it on the thyroid,
'Cause,
right?
like for example, for my case, I know this is not common, but since we've controlled my inflammation in my body, I've actually gone off of thyroid medicine,
Yeah.
which is very rare, I feel like, right? Like,
It can be. You did a lot more stuff where you did the stem cell IVs, you did a ton of different things that really helped that, but it is rare. Most
yeah,
people, their thyroid is so destroyed that you can't ever come off your thyroid hormone medication. You still have to correct all the imbalances that drive the autoimmune response, but they still have to be on thyroid medication. Whereas for you, your body was working so much better than what it was before. You actually had hyperactive symptoms just by taking your thyroid medication. So her TSH was now hyperactive instead
yeah.
of
I
a low
almost
thyroid. Yeah.
overcorrected it. So I was like
Yeah.
getting anxiety, like I couldn't take a deep breath. So he was like, just stop taking your thyroid medication. And that all went away. So, and now my TSH is like perfect.
Perfect.
Yeah.
And you reached out to him, so you had that very unfortunate miscarriage, and then you reached out to him right after that before Sophie.
It was not right after that. It was like, so after that, then they put me on the thyroid hormone. And then I just kept having all of these symptoms still, what I was talking about before. I was tired after having a full night of sleep. That was my biggest one. I was like, why am I still tired? Why am I always bloated? Like, why can't I lose weight? There were so many different symptoms I was having that after I went to my probably fourth endocrinologist, and he said, oh, don't worry about Hashimoto's, like, everyone has it and there's nothing you can do about it. I was like this. I did not like that response at all. So that's when I seeked for someone else. Like,
Yeah.
and I was like, I need to find someone else.
What are some symptoms that you would that you would, let's say, are red flags that you could tell to the audience? Be like, if you're experiencing A, B, and C, you should really
And which blood test to
Yeah.
get
which blood
asked for.
like
Yeah.
that. Yeah, we'll go into recommended blood tests, but like for symptoms specifically, what symptoms would you say are red flags for the audience out there to say to really to seek out some help?
Well, the most common symptom is if you're on a thyroid hormone and you don't know why you have a thyroid issue to begin with, that's red flag number one. Find a doctor that will actually find the mechanism driving your thyroid problem because there's always something that's going to be driving it. If you don't know what that answer is, find somebody else, right?
Yeah.
Then common symptoms will be depression, fatigue, weight gain, intestinal issues, swelling. Oftentimes, like their hands and feet will swell. They'll fluctuate in weight 5 pounds just based off of like where they travel, what they eat, what they do there.
That's what happened to me.
Yep.
Exactly. Every single one of those.
Yep. Anxiety, restlessness, headaches. There's a ton of different symptoms, but those are the most common ones that we'll see if you have Hashimoto specifically. But here's the problem. If you have Hashimoto's, you could still have other autoimmune conditions which cause other symptoms. And so just because you have a thyroid issue, if you don't understand what's causing that thyroid problem to begin with, you could have 4 other things causing other symptoms on top of that.
Understood.
Yeah.
So what did you say are some actionable advice? So let's say you've now received you received a consultation, or what are some actionable advice that you would say to somebody who's
'Cause-
experiencing those symptoms?
Yeah.
If you're experiencing those symptoms, I think getting the right test done is really important, right?
And what are those lab tests that you would recommend?
So the lab tests we'd recommend are a TPO antibody and an antithyroglobulin antibody. And then you can also run your total T3, free T3. You can do what's called a T3 uptake, which is fantastic. And then a standard TSH. If you did those lab tests, it would be significantly better than just doing a TSH alone, which most doctors do. On top of that, we also run inflammatory markers as well. So since Hashimoto's is an autoimmune condition, it causes inflammation to skyrocket. And if we can calm down the inflammatory response, that patient's going to feel significantly better. And so simple lab tests that you can run are a C-reactive protein. You can do homocysteine. You can do something called LDH, which is lactate dehydrogenase.
Those are all the ones you looked
Yep.
at me. Yeah.
Ferritin is actually an acute phase reactant. So when ferritin levels are too high, that can suggest that you have inflammation. But between those thyroid ones and the inflammatory
And the
ones that I
blood
just
sugar.
said, yep,
Blood
are
sugar's
great.
good too, right?
Yeah, as far as a diagnosis standpoint, checking your blood sugar levels are important. We like to see them around 80 to 130 regardless of what you eat. And then we typically will do like a morning cortisol, which is important. We can at least see from morning cortisol if you have issues. The best way to check for cortisol is actually through the saliva, but those are easy ones that you can do at home that are really inexpensive that you could at least find if you have Hashimoto's or not.
And then for those, and what what is like the key thing that you're looking to get out of those lab tests? What are the key things that you're looking to see?
Well, the biggest thing is if you have antithyroglobulin antibodies that are high and you have TPO antibodies that are high, you have Hashimoto's, no questions asked, right? So at least being able to target, if those come back positive, then you know you have Hashimoto's. And if that's the case, you know you have a lot bigger, more complicated problem than just a thyroid issue. Then you can start to attack the immune component of it, and your quality of life will be significantly better than just herding you around like sheep every 6 months. Here's your thyroid hormone, constantly
Yeah.
correcting it, improving it, decreasing it, and that's it. That's just, there's so much better things that you can do out there.
And every single woman who has Hashimoto's or man, like that has heard from their doctor that there's nothing you can do about Hashimoto's. What do you say to those people?
They are clinical dinosaurs. They are practicing a 1960 model of treatment. Don't listen to them. They're the type of individuals that you literally might as well grab an old like medical school book back in the 1960s and apply that information. That's what they're doing. Like, tell them to start looking at research on a consistent basis and know how to look for research. There is so much research out there that shows there's a million things that we can do to help your quality of life. And I would find a new doctor as fast as possible.
So let's say you are like Alex here, you are diagnosed with Hashimoto's. What are the first couple steps that you're going to recommend?
Well, like so for Alex, this is where it was important for us. If we identify that you definitely have Hashimoto's, then our goal is to then do all the proper tests to identify what other imbalances can trigger that in labs. And so the things that we'll test will be significantly different from like our first panel to everything else. Then we want to take a deep dive into identifying other imbalances, whether it's the intestinal tract, cortisol defects, hormonal imbalances, blood sugar imbalances, brain inflammation, neurological imbalances. The list goes on there.
I remember the first time we did our first test, and and honestly, everything came back semi-normal, and I'm like, so I was like, oh, I wonder what he's going to say. And he's like, oh, you have there's 3 major things that could be wrong triggering your Hashimoto's, and you have all 3. And I was like, oh my gosh, it was blood sugar was not stable. It was really low. But to another doctor, they'd be like, oh, you have low blood sugar. That's great. Like they've never once told me I have hypoglycemia there.
Yeah.
But he's like, that's an issue if you have low blood sugar. It could be triggering this. The second thing was my intestinal tract that he said wasn't good. And because I wasn't absorbing iron, I wasn't absorbing any of my nutrients that I needed to absorb from food. And then third, it was my hormones. It was like
Too high of estrogen.
It was like my ratio. You said it was something like, because they looked normal, but it was the ratio that was off.
Yeah, you want your estrogen progesterone ratio to be about 10-1. If it's worse than that, it flares up an autoimmune response a ton, and yours was like 200-1.
Yeah.
And so your body wasn't able to clear estrogen effectively, and this can be a huge problem for a lot of our patients. That's why like birth control, things that we do that spike estrogen into our lives can cause a lot of problems for autoimmune response too.
So that was crazy. But now what we did together was, targeted each thing. The first thing that you do when you do get diagnosed, obviously after you see a doctor, is to go on the anti-inflammatory diet.
Yeah, so typically what we'll do is we'll do a food intolerance test and figure out what foods that they're eating that are actually causing the autoimmune response to flare up. And in the meantime, we'll put them on what's called the inflammatory reset, where they avoid foods that are inflammatory for about 3 weeks. And then once we get the food intolerance test back, we'll add foods back into their diet pretty strategically from there. But it's
I did it. It was hard.
Yeah.
At first.
She was hardcore. She felt so good. She's like, I'm not adding in foods. I feel too good.
Yeah.
And so
I just cut out everything, and I'm like, they're gone forever from my life.
So what are those foods?
Like the top, I would say, like you said, the top 3: gluten, out. Dairy, out. Soy, out. Those were like my top 3 that I always like. I basically say I'm allergic to them because I just don't even want them near me. But there's a lot of other ones. Like there's a full page of things you have to cut out. Those were the 3 I think biggest. Oh, and sugar. Refined sugar was hard for me, obviously, because because of the donut shop. And I'm like, what am I gonna do? I can't taste any of my flavors.
Yeah.
But it was just for 3 weeks, so it was fine.
And then look, here's another thing too. When a patient's improving and their autoimmune response has calmed down and the inflammation has calmed down, they'll be a lot less intolerant to foods. So at first, a patient might be intolerant to 10 to 15 foods. By the time they're done and their body's functioning much better, they might only be intolerant to 1 to 2 foods.
Yeah, because you've like repaired the lining of your gut, right?
Exactly. So if you can repair how you digest your food, if you can repair the intestinal lining, if you can repair the brain and get the brain to function and fire more effectively, like it makes a huge difference. So with you, identifying foods, the imbalances, those are big key things that we did to make a big difference. There's a lot of patients, though, that end up having brain inflammation and their brain doesn't fire properly, and that causes lots of problems. So if a doctor doesn't understand the neurology behind like an autoimmune component, which most people miss, that can lead to a lot of problems too, because the brain actually fires to the intestinal tract and does a ton of different things to help them digest food. So if the brain doesn't fire properly, the patient could have a ton of different symptoms. And so even just touching on the neurological component is important. Like we could teach this for the next probably 3 days straight. There's so much that goes into it. But to give you an idea, like into my brain, okay, a patient comes in, if they have these issues and problems, here's some generalized things that you can do. Like for example,
he would test me. I remember he would do all these neurological tests to see how my brain's functioning.
See pupil dilation, see which side of her brain maybe isn't functioning as well. Is she in a sympathetic response to where the parasympathetic response isn't functioning well? There's so much that goes into it.
Yeah.
But, and then to go over this too, so you kind of understand, here's how a standard doctor will treat patients. Just give me an idea. They give you thyroid hormone replacement. Here's how we do it. We identify the autoimmune response. We'll work on blood sugar imbalances, cortisol defects, neurological dysfunction, the intestinal lining. If they have the methylation problem, the liver will correct that. If they have detoxification problems, the liver will correct that. If they have hormonal imbalances, we'll correct that. The list goes on.
Also, you're my therapist.
Yeah. And so we'll correct those things. Plus, we'll teach them and educate them and show them what to do and what not to do so that they know how to manage their condition long term through diet, lifestyle, nutrition. Something that's really easy that most people don't realize, and there's tons of research that shows it, is if you have an autoimmune condition or Hashimoto's, vitamin D increases regulatory T cells, and that calms down the Hashimoto's. Just
Oh
that
yeah,
one
my
thing.
vitamin D was so low.
Yeah.
Yeah.
It's really common for Hashimoto's patients to have what's called vitamin D receptor polymorphism. So the vitamin D doesn't bind to the receptor properly. And so Hashimoto's patients have to be on a much higher dose of vitamin D. And obviously, when you're doing vitamin D, make sure there's a really good effective K2 as well. But you want to make sure that you're on a good dose of vitamin D because it increases regulatory T cells, which calms down the autoimmune response. Something as simple as glutathione is incredible for Hashimoto's.
So if you think, just to, because you're talking about this, what are like 3 supplements that every single Hashimoto's patient should be on?
Vitamin D K2, glutathione, and if they have a methylation problem, methylated B complex. And so
What's
a way that you can check for a methylation problem is by checking homocysteine. It's like an $8 test. Almost 50% of all people in our country don't methylate properly.
What is,
And
can you
all they
explain
have
that?
to do, well, your liver goes through a methylation process. It helps methylize hormones. It helps methylize B vitamins. If somebody was to take, let's say, folic acid, which is in a ton of different stuff, it can't process folic acid, and so it builds up in your body, and it causes tons of problems. The way that you check that, though, is checking for homocysteine, which is an $8 test. If homocysteine is above 8, you have a methylation problem. Lots of people listening probably have heard of the MTHFR gene mutation. That's a really common one, but an easy test is just checking for homocysteine. So if you have a methylation problem, which is the likelihood that you do, then a methylated B complex. So vitamin D, glutathione, and a methylated B complex would be probably my top 3.
Awesome. I'm on all 3 of those.
And I'm very curious. I mean, you touched on it for a second. Outside of the autoimmune, outside of the Hashimoto's journey and conversation that you guys you're having, you touched on stem cell research a little bit.
Yeah.
Could you maybe just kind of give the audience a little bit of explanation on what stem cell research is?
I treat a lot of high-profile athletes, and we'll do injections with stem cells. Back in the old days, we used to take their bone marrow out or lipo their fat and cycle down the stem cells and then inject it into whatever joints we're struggling. But now we found that umbilical cord stem cells are even more effective and have a lot better growth factors and cytokines that help the healing process to function there. So now we use umbilical cord stem cells. It's a lot less invasive than what it used to be when we would take out their bone marrow when they feel like their spirit just left their body.
Ouch. I heard that.
But so I spend a ton of time doing stem cell orthopedic injections, and we also do stem cell IVs, which is fantastic. So what this is doing is it's providing growth factors and regenerative signals to help the body heal itself, to decrease cytokines, to decrease inflammation. It does tons of stuff. So with Alex, we did a few stem cell IVs with
IVs,
you,
yeah.
and then after that is when her thyroid kind of normalized, and because she was taking her thyroid hormones, it started to just overproduce thyroid hormones where
Yeah.
she had anxiety and restlessness. And now she's off of thyroid hormones, and we've been checking her TSH, and it's just within normal range, and it's awesome, which is
Yeah.
rare.
It's been in normal
But
range for consistently for like 6 months now.
yeah.
So.
And the last test we checked, it was the best it's ever
Yeah,
been.
I know.
Yeah.
So crazy.
Yeah. So just I guess for the general audience, person who's not so keyed into stem cell research as a whole, like I mean, there was a lot of conversation about the like is it, for example, let's just go from, and we can cut this out. But like is it legal now?
Yeah.
So
Yeah.
people, so some
That's a
people
great
maybe
question.
have not heard
Yeah.
about it. So is it legal now? Is it can you just like
'Cause in the
where
United
do you
States.
Yeah.
in the United
So
States, where do you get
yeah,
them from? Where do you
those are
source them from? Those kind of questions. Is
yeah,
that
those are great questions.
yeah,
So in the old days, we would have patients that would end up going to Mexico
Yeah.
or Colombia or Panama to get stem cell treatment. Whereas now we can practice stem cell treatments all day long in the United States. There's kind of a misunderstanding there. The difference, though, is that when we use umbilical cord stem cells, we have to use the primary cells. In like Colombia and Mexico, they can use these cells and they can just replicate them in a lab over and over and over and over again, which don't make them as potent, but they make them a lot less expensive.
Yeah.
And so in the United States, we can do stem cell treatments all day long. We just have to use the primary cells themselves, and we can't replicate them in the lab.
Oh, interesting.
Yeah, which it's a little bit more expensive, but it's also makes it more potent and also more effective as well. And so we can do all that stuff. I just think we have to be really cautious about how we say we're doing stem cell treatments. Like there's people out there that will say crazy things about stem cells. They don't really understand the molecular biology when it comes to stem cells and
Yeah,
what it
you can't say
what
it
it does. Like
cures.
we're not going to say it's going to cure your MS or your
Yeah.
Parkinson's or Hashimoto's or any of that stuff. That's just not the case. It's a therapeutic thing that we can do to help decrease inflammation, to help your overall health. But the patient still has to manage their condition on the long run.
Yeah.
Even when we do stem cell injections, so like we mainly do orthopedic injections, and it's awesome. So we'll have players that will come that wouldn't get back to playing for 6 weeks that are back to playing in 3 weeks. And not only that, but it heals a lot more effective. So a lot of times you'll see where people will talk about stem cells where we inject stem cells and they say that it like turns into ligaments and tissue and joint tissue, all that stuff, right? That's not really the case. When we inject stem cells, what happens is it delivers cytokines and growth factors and regenerative mechanisms that help the own body's response start to heal. When you get a little bit older, your stem cells don't migrate well. And so what we're doing is we're putting in stem cells and it's allowing your own body's healing response to improve and function and be better. It's really cool stuff
Yeah.
though.
My mom did it
Yeah, and so
in
the
her hip.
general population could book an appointment with you, fly to your clinic, and
Yeah,
receive stem cell
you
injections.
betcha.
And they are like, because I there was some conversation again from a layman's perspective. There was some conversations about like sheep stem cells compared to human. So are you using like
We're using like somebody can deliver a baby and then they can donate their umbilical cord from there,
exactly
and we're using human
using
cells.
human?
But these are after a successful birth of a baby. Like they aren't like embryonic stem cells from a dead baby or whatever they may be. These are actually like successful C-section birth, donating the umbilical cord. We're not using like whale stem cells or shark stem cells or sheep or whatever the heck that is,
I
right?
know you
We've
told
we've
me
totally
they're
heard
like
about that.
Exactly.
they're you like said that they're like tested for all sorts
Oh
of
yeah.
diseases and things
They're
like that too,
tested
right?
in a million different ways.
Yeah.
They're heavily vetted.
So if somebody wanted to book that with you, like what would be like what's the timeline? What's the process? 'Cause
So if they wanted to book a stem cell treatment, our medical director, her name's Heather, she kills it when it comes to injections. She does a really good job, and you would book through palmavitaclinic.com.
Mm.
Our autoimmune clinics are redriverhealthandwellness.com, and you can schedule for a consultation. And yeah,
And you do the consultations online.
And there's one in Vegas too. Where
There's one in
where do you want to talk about where they are? Because you
yeah,
have them all
yeah.
over.
So we have clinics. The Red River clinics are in Henderson, Boise, New Mexico, and then 5 in Utah.
Cool, right?
And then, but
Yeah.
even then, we see patients from all over the world through telehealth
Telehealth.
as well.
Yeah. That's
And
great.
then my stem cell and longevity clinic is in Spanish Fork, right across the street from the hospital in Utah, and it's great.
I love
Yeah.
it.
Have you
Been there
guys-
twice.
Yeah, and so now, I mean, because we're running a little short on time,
Let's
and
do
I
the
know you're short
question
on
and
time, but yeah, we'll
answer,
do the question and answer. But before we do the question and answer, I would just like for you guys to reflect on what do you think like the success journey of when you started to reach out to him to today? What have you seen in terms of a success? What have you seen in terms of failures? What have you seen in terms of anything like just what's
Yeah.
your journey like?
Can I
I'm-
say?
Go.
Can I say something? Then you go.
Yeah.
What I remember talking to her, which was really funny. I was in Hawaii, and you were on speaker, and my kids like heard your voice. They're like, "Who is that?" Because I don't tell anyone who my patients are, and they're like, "Is that Alex?" Like they're like, I'm like, "Oh crap!" But anyways, I remember that day where I talked about how many good days do you think you have out of a month where you actually just feel really good all the time. And I remember you said a few good days a month.
That's great.
And your quality of life was just terrible. And now, how many good days do you have out of the month?
I honestly can't even remember a bad day. Isn't that nice?
Yeah, I love that.
That's
awesome.
crazy.
That's crazy.
Yeah,
That
it's-
would speak to a successful
Yeah, I
journey.
wake up. I can wake up at 6 a.m. now, and I feel awake, refreshed. But I don't. I'm super strict. Like he knows. He's like calls me his like favorite patient because I go hard on this diet, and
Yeah.
I'm like super strict. I take care of myself. I've put myself as a priority. I think that's really important. I think a lot of women start to forget that they're the priority after they have kids, and
Totally.
I mean, obviously your kids are a priority, but you also need to put yourself first sometimes, you know? So I don't ever leave the house without eating breakfast. I always make sure I take my supplements. You know, one thing I think a lot of people don't know about is matcha, like the matcha conversation you told me. So there's a lot of conversation around matcha right now and how it actually prevents you from absorbing iron. But Dr. Red actually taught me this is that it's okay to have matcha. You just have to have it an hour after you eat. And as long as you're not having matcha while you eat, is that correct?
Yeah.
Then it's fine.
Yeah, that's a really big thing. So lots of people are taking matcha with their iron supplement, and it's not.
Yeah.
It's combating it. So you won't absorb your iron when you take your matcha. And so we typically will have our patients take their iron supplement 2 hours after their breakfast or their matcha or whatever that may be, away from anything else, because iron competes with a lot of nutrients and other things. And so you just have to be careful with, if you really have anemia and iron deficiency issues, which that in of itself causes so many different symptoms and problems, you have to be very careful about when you take your iron supplement and how far away from matcha or other foods it is.
Isn't that funny? Like because everyone's talking. Have you seen that all over
Yeah,
social
yeah,
media right now? Everyone's talking about matcha and like
yeah,
being iron deficient, and I'm like, it's
yep,
just because they don't know when to drink their matcha because matcha is so
exactly.
popular right now.
Yeah.
But
So,
yeah, I feel amazing, and I'm just so grateful for our friendship, and
yeah,
I know we have a lot more to go, but
yeah.
you know,
And we'll
it'll be
definitely
great.
do another podcast. I'm sure you'll
Yeah,
have
but I put a
more.
question box on my story, and I was like,
Oh, nice.
I
Look
was
at all
like,
those
I
questions.
know
Let's
this.
go.
I know. So I wanted to just answer some of our most asked questions. So let's do it. You want to
So
read them to us, Chris?
yeah, of course. So the first one we can say, I mean, you kind of touched on it, but I'll have Dr. Red touch on it a little bit. What are like the number one, or this is from, let's see, Mommy of Boys 3. What are the top 5 foods to avoid if you have Hashimoto's?
Top 5 foods. Okay, let's break it down. We go gluten, dairy, soy, sugar, and then this will be bad, but artificial sweeteners. And the reason why with artificial sweeteners is they actually destroy the gut microbiome and will induce intestinal permeability and cause problems. So those five are probably my top.
I can just chime in really quick because everyone's going to be like, "What? No sugar?" But organic maple syrup is approved.
Yeah. You can have your
Yeah.
fruits, organic
Yeah.
maple syrup, honey.
Yeah.
There's lots of really good things. There's even healthier versions of stevia, for example, that you can have. But artificial sweeteners destroy the gut microbiome. Sugar spikes blood sugar levels. Gluten, dairy, and soy, those would be my top 5.
And so you mentioned soy, and earlier in the podcast you mentioned that American soy, and I did watch this documentary on Netflix called like the Blue Zones, where they study kind of average people that live to over 100 years old, where they eat like in Japan, where they eat like
Yeah.
what can you
That
what's the
real
difference?
soy
Yeah.
can actually be really therapeutic for you. It could be beneficial for your hormones, all sorts of stuff.
What are they doing in America?
America's soy isn't even real soy. It's just structurally engineered to be something that's like soy that's not even it's so completely processed, and there's so many problems that comes with American soy. It's just like a funny story. Can I tell you a funny story about my father-in-law just because he's in the back right here? My father-in-law got on this kick where he started eating a ton of soy. Like everything was soy related.
Yeah.
And he's like, Josh, do you know why like I'm emotional? I just have like these weird symptoms and problems. He was like, nipples were sensitive. He's more emotional, things like that. And I was like, what are you eating? Like first let's break down what you're eating. And he like just started listing off soy milk, soy. He had lots of soy. And I was like, that's the soy. And like immediately he got off the soy and felt significantly better just from that. Sorry. I won't mention your name, but sorry, Steve-O.
Steve. Yeah. So, okay, question here from, let's see, from Jennifer Rocha. She said, what anti-inflammatory snacks for on the go for busy days do you recommend?
Let's see.
What do you recommend?
Oh,
Let's
that's a
hear
good
you.
one. My snacks, chia pudding, but with coconut and coconut milk, delicious. I also do a lot of date. I love my date filled with like cashew butter, and I do like some nuts on top. I do a fruit cup. It's always really good. Let's see. What else? What are some other snacks?
I like protein with your snack just because it helps stabilize glucose.
Yeah.
So having some form of like nut or almond or whatever, cashew or whatever that may be
Yeah.
with your snack. I love Chomps jerky
Yeah.
because those are really healthy form of jerky that doesn't have all that different artificial stuff in there and things that could flare up Hashimoto. So Chomps jerky is great. We like Scout bars. Those are fantastic. It's with organic, pretty much everything. There's no artificial sweeteners. There's no
Like a good
artificial
smoothie,
dyes.
too. Like
Yeah,
smoothies are
totally.
good. Yeah.
All right. That's not. And then there's a question here from, let's say, about I can't see your name. It's cut off in the screenshot, but it's okay. So it says, do you ever have joint in your Hashimoto's journey? Have you ever experienced like joint pain or muscle pain? And then how did you manage that?
Yeah, I definitely did, but it just came from symptoms of
Yeah.
Hashimoto's and when it gets worse, when it's inflamed. And he always tells me like if you have one bite of sugar or one bite of those things, like your symptoms are going to come back, but it takes 3 weeks to get it back to normal.
Yeah.
Yeah.
This is kind of a scary thing for patients. So you have the intestinal lining that's nice and thick usually. Guess how long it takes to break that intestinal lining down by eating something that you shouldn't eat?
How long?
3 minutes.
Oh,
And then guess how long it takes to improve?
3 weeks.
Yeah, if not longer.
Isn't that crazy?
So that's important. But for the joint problems, here's the thing. Hashimoto's causes a ton of different inflammation in the body, which symptoms of that will be like joint pain, brain fog, fatigue just from that. But then also if you have Hashimoto's and you have joint pain, there's a high likelihood that you could have rheumatoid arthritis as well,
Mm.
or like early stages of it. And nobody catches this stuff. So you run like a rheumatoid factor or anti-CCP is what we call it. Or you could,
Interesting.
you could run an ANA with a titer, and then you can see, are there other autoimmune conditions that you have besides Hashimoto's? And so a ton of patients that have Hashimoto's that also have joint pain, the likelihood of them having like lupus, rheumatoid arthritis are going to be significantly higher. And so checking for that is important, but then also calming down the autoimmune response as fast as you can to minimize long-term problems is going to be important as well.
right. And then the last question here from Kristen Taylor. Um, Talk about, I guess, like makeup, skincare products, perfume, shampoos. How do these external products affect your Hashimoto's?
I think that it affects them greatly. I actually do non-toxic everything. I look for that. I do non-toxic makeup. I do non-toxic skincare. I've actually been using this. It's like a beef tallow. Have you ever heard of
Yeah,
that for the
yeah.
skin? And my skin has never been better. Like I used to have like these little bumps on my skin. Like I don't have that at all anymore. It's like super clear. And I don't use any perfumes. I use this like roll-on essential oil. So I've tried to eliminate as much toxic in my environment. I've tried to like remove all toxins, but I obviously you can't remove everything,
Yeah.
but
But
like
that's been
even
the
my water, right? Like I have a glass water bottle.
Yeah.
but that's been the conversation. Like Jessica Alba, like The Honest Company, Goop, Gwyneth Paltrow, like they're all talking about no toxic. They're all talking about no perfumes. That's like, so would you speak? You kind of speak on that as
Yeah,
well? Do you agree?
1000%.
Mhm.
So there's kind of layers that we try to treat a patient. If we make all these changes all at once, the patient's going to have a panic attack and
Yeah.
anxiety from all the stuff we're changing, right? So our biggest goal is to first work on physiological imbalances that trigger it, then work on diet and lifestyle things that might trigger it. And then once the patients function really well and they're progressed and they're educated, then we can start making some of those subtle changes from an environmental standpoint. But you bet there's tons of things that we're putting on our skin that we're using that are causing estrogen to increase. And they mimic estrogen. So they'll bind to receptors stronger than estrogen and actually make estrogen increase throughout our body or mimic estrogen. And then that flares up the autoimmune response like crazy. And so just minimizing the environmental toxins that we're exposed to each day can make a big difference. But I'll also preface this. There's a ton of things that you can do to improve your immune resilience. And then you can be and withstand lots of things. You can be around lots of things and not have a flare up and not feel bad. Sometimes I feel like people get so hyper focused on they have to do all these things almost in a psychotic fashion. And then they're like,
Where I'm at right now.
I have to live in a bubble, but now the bubble's made of plastic, so I can't even live in that bubble, right? So it's like they're just so confined to all these different things that they have to do. And my suggestions would be to just work small. Like there's simple things that you can do. Once you master those simple things, then you can build off from there.
Yeah.
And then once you do those, then you can build off from there. Then once
Amazing.
and so
And
on.
do you think so? Like Alex, let's say, is able to. She has success in life to where she's able to focus on this journey. Would you say like the mother of two who's working like a full-time job, 40 hours, is able to also? Would you say that it's possible to also have this journey?
1,000%. If Alex can do anything, if Alex can do it, there's not a living person on this planet that can't do it either.
Yeah.
I mean, anyone can do it, right?
Yeah.
So let me just restate
I
that.
work 80 hours a week.
No,
I'm just
I don't know if like my question.
just-
if I question,
Yeah,
myself-
let me
Yeah,
state
yeah.
this. So if Alex can do this, every single person on this planet can do this. I don't have a patient that's busier than her.
Yes.
And then you throw her husband on top of that works. I mean, I don't even think he sleeps.
I don't
But
think so.
but they are so busy and they are doing so many things and they're still able to get their quality life and do these things to
Yeah, it
function
takes
and feel
help
better.
though. Like for example, like I don't have time to cook every single meal, so I do get meal prep,
That's fine.
I do, so there are things that I try to make my life easier, so I do the meal prep helps so much, so that's like one thing that I do regularly. Obviously
And then
working
like, the
out and all those
non-toxic
things.
products are not necessarily more expensive.
I mean, maybe a little bit more expensive,
but a
but
little bit. Like,
but not that much.
Not
And they
double.
may not even be that much more expensive.
Yeah.
There's a lot of really good brands out there that do so much better from a non-toxic standpoint, right?
Yeah.
Dime is one of my favorite brands. Have you heard of Dime before?
No,
Yeah, Dime products are fantastic.
Non-toxic everything.
Non-toxic everything. Just Ingredients, who I formulate for, has tons of products that are incredible out there.
Yeah, because do you know
Um,
what? The supplements is crazy. Like, because a lot of people that I know, like, for example, like those 3 supplements that we named off that you should, anyone on Hashimoto's should be taking, like, do not go on Amazon and just buy any
No,
supplement.
no, don't
Like,
do that.
yeah, like we'll put the link down below to his Just Ingredients one because they have it like third party tested. Tell them about the turmeric thing you told me.
Yes, one of the most common things that calm down the autoimmune response is turmeric.
Mhm.
And as we're checking supplements, we're checking suppliers, we're checking the manufacturer. We test as they come to the manufacturer. Then when they leave the manufacturer, we test. And then when they're in the bottle, we test. We tested turmeric from one of our suppliers, and all it was sprayed rice powder orange. And so the supplements that you guys are taking on a consistent basis may not even be what they are. So make sure that you're working with a reputable company. And I don't really care if you use my Just Ingredient supplements.
Yeah.
I think they're the best on the planet. I am OCD about everything that we do with those supplements, but just make sure that it's from a reputable brand and they're third party tested and they actually are what they say they are.
Yeah. Because that's really scary.
Absolutely.
Yeah.
Yeah.
Like even vitamin D, for example, if you don't have a really good quality K2 with it, then you can build up calcium in your arteries, hair follicles, liver, lungs, other places. And so our vitamin D3 is organic, but we have the best absorbable K2 there is that I know of, which just minimizes those problems. So when I'm creating supplements and making sure that I'm providing the best quality stuff for our patients, that's my goal.
Yeah. And then do you want to talk about, because a lot of people may not know where to start when it comes to that anti-inflammatory diet. So you can talk about your book.
Yeah. Our book is coming out January 6th. You can pre-order it right now. We'll put up a link for you.
Yeah.
But you can pre-order it right now. It comes out January 6th. Last time, I think we ran out of stock in, I want to say like 7 days.
Wow.
And this new book, The Inflammatory Reset, has about 45 more recipes. We added about 90 pages worth of literature and research and just things on how you can do it. So it's almost like we're holding your hand throughout this process, making it as easy as possible. So if you can't afford to go to a functional medicine doctor or to Red River, this is an incredible step. This is something that you can do. And it comes out January 6th. It's going to be fantastic.
I love it.
Mhm.
Awesome. Well, thank you guys. Thank you so much
Yeah,
for being
thanks
here.
for having me.
Did you have
This
fun?
worked out. Oh, this is awesome. What a great set, too.
I know.
This is
We'll do it
perfect.
again. We'll do it again. If you guys have any questions for Dr. Red or for myself, please leave it below. And thank you for watching.
Let's make progress together.